Hey everybody, Dr. Patel here. Sorry about the delay getting started. Welcome to my Facebook Live. It's been a while since we've done Facebook Live here. Actually, it was December the last time that we did it. But that's because we've moved to a new office space location. Our new primary office space is in Newport Beach. We're still coming up to LA once a week, but we're now in Newport Beach, and that's where we're at right now. So we're going to hopefully start doing these Facebook Lives again on a once a month basis. And if there's any specific topics that you want me to discuss or go over, then please let me know. And today we're actually going to be starting to talk about a topic that has become more well known now, but still seems to be something that's under the radar. It's something that we've talked about in the past in one way, shape, or form, but definitely something that I think is actually underdiagnosed in our general musculoskeletal patient population, and that's the topic of hypermobility. So if you like this video, if you find it helpful, please share it, like, subscribe, all that fun stuff. But what we're going to do is talk about hypermobility and answer a few questions that we might have about it, including what is hypermobility, what can potentially cause it, is it necessarily a bad thing? What are the possible symptoms that are associated with it, as well as what are the treatments that we should be considering for this type of scenario. So hypermobility, hypermobility, when we kind of think of it most commonly, people think of it as this picture here. When you think of contortionists or people that are double jointed, that's what most people kind of think about when they think about hypermobility. The reality is that hypermobility is probably something that is more common than we recognize, and doesn't necessarily mean that you're able to touch your toes to your nose or anything like that. Now, hypermobility refers to the laxity or looseness of our ligaments. So we have ligament structures that are the duct tape that connects bone to bone. But in actuality, ligaments are really structures, soft tissue structures that are connecting all of our bones together throughout our body. And the quality of ligaments is not really like duct tape. If it was like duct tape, then we wouldn't be able to move at all. But the quality of ligaments are like those thick rubber bands that surround broccoli in the grocery store. And if you're one of my patients, or if you've heard me talk before, then you know that I like this analogy. And that's because it really helps us visualize what ligaments are like and how they act when we're moving around and all of that kind of stuff. You see, ligaments are, as I said, those rubber bands that surround broccoli in the grocery store. So they're strong, they're supportive, they keep the bones together, but there is some stretch to them. Otherwise, we wouldn't be able to move, right? So these ligaments allow us to move around, allow the joints to move around, but they're still supportive structures to keep things in place and keep things stable. Now, when we're toddlers and when we're little kids, our rubber bands are naturally a little bit looser. These rubber bands are loose in order to allow us to quite literally bounce back from injuries. This is purposeful, right? Because kids are always falling. Kids are always moving their arms and legs around and twisting in various different ways, and our rubber bands are a little looser at that point to allow kids to move, and play, and jump, and do stupid things, and get injured without tearing ligaments, right? If the ligaments are too tight and they're just learning how to run and move and twist, then that then there's the risk of those ligaments actually getting torn. And that happens less frequently in kids, and that's because their rubber bands are a little bit looser in general. But gradually, as we get older, our rubber bands, our ligaments, start to get tighter over time. Now, there are some folks that those rubber bands actually stay somewhat loose. And that is a condition called hypermobility. There are a variety of different reasons that hypermobility can occur. When most people think about hypermobility, we're thinking about conditions such as Ehlers-Danlos Syndrome or Marfan's, basically connective tissue conditions that genetically your connective tissue is not strong, or is not healing appropriately, or it's made in a fashion that the ligaments are looser in general. But aside from these genetic conditions, I think that there's a lot of reason for hypermobility to occur, a lot of which we actually still don't understand. Genetically, there are some folks that just have looser ligaments, even if it's not truly a connective tissue disorder. On the other end of the spectrum, there are folks that can cause hypermobility to their bodies. So 2 instances of hypermobility that's not necessarily a genetic or innate thing, but can be caused to the body are for example, if somebody has too much manual manipulation repetitively over time. So you may have heard of patients, or maybe you yourself have gone to a chiropractor for maintenance over the years. That could be a potentially reasonable thing for some folks that have musculoskeletal conditions. However, there's some camps of chiropractors and other manual therapists that do kind of cracking maneuvers on a repetitive basis just to keep people aligned. But that's something that can actually cause the ligaments to get looser over time. I'll give you an example. I'm a DO, an osteopathic physician, and we do some manual therapies that have some similarities with chiropractic. And when we were in medical school, we learned this partially by treating ourselves. And I distinctly remember studying for an exam with my friends, and one day feeling like a crick in my neck and turning to tell one of my friends, hey, you think you can do some manipulation on me? But he was sitting behind me, and I turned my head like I was a freaking owl. And at that moment, I realized maybe we've been doing too much manipulation on ourselves, right? Because your head's not supposed to turn 180 degrees. And I recognized that we were manipulating ourselves so frequently that our range of motion was slowly increasing beyond what was a normal range. And that occurs because our rubber bands were slowly getting stretched over time. So you can induce hypermobility by repetitively doing an activity that can cause the rubber bands to loosen, right? You're taking those thick rubber bands that surround broccoli in the grocery store, and you're slowly stretching them further and further. Another example of that is if somebody enjoys sports such as ballet or activities such as yoga. These type of activities really pronounce stretching in various different ways. And again, the repetitive excess stretching could be something that causes ligaments to get looser. Various different dancing, gymnastics, even certain sports that you may not think of as causing hypermobility. For example, even things like tennis. So tennis, how is that going to cause hypermobility? Well, repetitive motion in terms of swinging your racket, even people like pitchers or other overhead athletes, A form of hypermobility could be if there is induced or created laxity or looseness of the ligaments around the shoulder. Right? A pitcher, for example, can be repeated, have repeated throwing of a ball or something along those lines, and going into that full range of motion over and over and over again can cause some laxity to the ligaments of the shoulder. And that's not a systemic hypermobility, but that's more of a focused hypermobility that's specifically at a joint. But this is the type of thing that could be induced or caused by activity. Now, when we have this looseness of the ligaments, does this actually necessarily equal symptoms? And the answer to that is no. Right? Going back to talking about children and toddlers, right? These kids have hypermobility by definition, but they don't necessarily have injuries associated with it. I'll use my daughter, for example. My daughter just turned 4. And she is a very, very active little girl who loves gymnastics and loves various different physical activities. And she's doing really well overall. Now, that being said, she has put herself into situations that have caused little injuries. Twice already over the course of the last couple of years, she's had nursemaid elbow, which is a kind of dislocation, subluxation of the elbow that occurs when she occurred when she was hanging from some monkey bars and kind of twisted, and her elbow kind of popped out of position. That she was capable of doing that dislocation, kind of subluxation of her bones, was able to occur because of the looseness of her ligaments. So having loose ligaments does not necessarily equal symptoms. However, having loose ligaments can predispose to some certain types of injuries, such as dislocations. Additionally, loose ligaments, if they continue through adulthood, can also predispose to certain types of injuries as well. Now, as we get older in general, as our joints are moving around, we all get some wear and tear of the joints. Meaning, as there's motion between bones, the smooth surface of the bone where the joint is starts to gradually rub over time. The smooth cartilage starts to wear away, and then the bone starts to get rougher. Over time, there are further changes that occur, and that is one type of osteoarthritis, or wear and tear of the joint. That's something very common that occurs in everybody as we're getting older, and that does not necessarily equal pain. Now, one thought process about how osteoarthritis progressively worsens is if there's looseness of the joint, if there's excess mobility of the joint, then that would allow for more rubbing or wear and tear of the smooth cartilage and more friction on the bones. And then the bone's like, hey, there's a lot of mobility here. There's a lot of friction. And the bone, being a smart tissue, living tissue, actually is like, all right, I got to bulk up in order to provide stability, right? So the bone actually can bulk up to provide stability where there is not. And when the bone bulks up in that manner, that's called bone spurs. So bone spurs, as a part of the osteoarthritis spectrum, bone spurs actually occur because of the excess friction, excess pull, excess pressure to the bone. And that occurs when there's excess mobility. So if we have looseness of our ligaments as we go through into adulthood, that could actually predispose to worsening conditions of osteoarthritis and wear and tear of the joint. But again, that doesn't necessarily equal pain. But as we have that looseness of those ligaments and as we have that wear and tear, if we then put abnormal pressure into those joints, if we're not firing our muscles correctly, if we are not moving correctly, then it's easier for those joints to get irritated. So it is common for us to see various different joint pains occur in the setting of hypermobility. So far we talked about two separate but somewhat interrelated things. We talked about dislocations or subluxations that can occur when the ligaments connecting bone to bone are loose. And then number two, we talked about irritation to the joint itself in the setting of like wear and tear or osteoarthritis. But are the joints the only things that can get irritated with hypermobility? Well, not necessarily. I mentioned that the bone of joints can react to the excess motion and cause things like bone spurs. Well, there's other things that react to the excess motion as well, right? If the ligaments are loose at a particular joint, then the muscles that surround the ligaments, the muscles are strong and supportive and smart things. The muscles are like, oh man, these ligaments are loose. We have to tighten up in order to try to provide support. So just like the bone bulks up in order to try to provide physical support, the muscles also tighten up in order to try to provide support to those loose ligaments. And the muscles tightening up can cause certain symptoms to occur. Number one, the muscles tightening up can cause soreness or spasms, right? But the muscles tightening up can also cause fatigue. So imagine if a muscle's trying to keep joint together for a long period of time. Well, the muscle's going to tap out. It's going to get tired. It's going to get fatigued, right? For example, try a biceps curl. Try to hold a biceps curl for 5 minutes. What's going to happen, right? Your muscle's going to fatigue, and you're going to lose that muscle. Now, you're going to lose that curl. The same type of thing can occur with the muscles that are holding various different joints together. So a common area that this can occur is actually in the neck and in the traps. So the traps are these big muscles that go from the head all the way to the tip of our shoulders and to the upper back. And these muscles are the great reactors. These muscles tighten up in reaction to a multitude of different things. But imagine if the ligaments that are connecting all of our neck bones together are inherently loose, right? Whether you have a systemic or genetic hypermobility condition, or you've had too much manipulation of your neck with manual therapy over time, then those rubber bands are looser and those joints are moving around a lot. So guess what? Your muscles, your traps, your paraspinal muscles, etc., will all tighten up in order to try to provide stability. Now, the smaller muscles, the paraspinal muscles, the multifidi, all the suboccipital muscles, the muscles in the front of the neck, gradually, especially these smaller muscles that are not as strong, will be wearing low. They'll be tapping out. They'll be getting fatigued. So the bigger muscles like the trapezius end up being tighter in order to try to protect the area. And that's why we oftentimes get big knots throughout our traps. The same thing can occur with the muscles of the buttock and the hip. So the picture on the screen right now is an example of the low back area where this, let's see if you could see this. I don't know if you can see my mouse. There we go. This is the low back. This is the pelvis on either side, and these are the hips. We're looking at the front of the pelvis, and then this is the sacrum that's in the back. And all of these lines here are the webs of ligaments that are throughout these areas. Now you can imagine if these rubber bands are looser, then the muscles that surround these regions will all tighten up. So for anybody that has pain in the buttock area, pain in the low back area that feels like tightness, that feels like spasm, then these may be, these sensations that you feel may be due to the muscles tightening up in reaction to the ligaments being looser. Now, if we have these muscles tightening up, and what oftentimes happens is the muscles are tightening up differently on one side versus the other, that can oftentimes cause some asymmetries in terms of the way that we're moving, and can lead to some of the asymmetries that people have diagnosed in like your sacrum being out or your pelvis being out of position. A lot of a lot of clinicians, physicians, physical therapists, manual therapists, chiropractors, etc., oftentimes diagnose, your pelvis is obliqued, or your sacroiliac joint is out, or things along those lines. I have a love-hate relationship with these kind of concepts, because the truth is that these joints, these issues do move, and these can be pain generators, particularly in patients that are hypermobile. But it oftentimes is a result of the ligaments being loose and then the muscles not firing correctly. With the exception of situations of specific traumas that occur, things don't go out unless there's a reason for them to go out. But hypermobility is a reason, as well as the muscle imbalances. Muscle imbalances are definitely a reason for things like your sacroiliac joint to go out. So the conventional treatment that most people get when their SI joint goes out, or when the neck goes out, or whatever goes out, is to get manual therapy to put it back in. But if we put it back in and we don't get the muscles firing properly, well, then you're just going to go back out again. And if you put the joint back in and it goes out, and you put it back in and it goes out, and you put it back in and it goes out, well, there's the risk that each time we're doing manual therapy, and particularly the more aggressive, direct, high-velocity, cracking type manual therapies, then we run the risk of causing those ligaments to get even looser. So we get back into position, but our ligaments are getting looser, so then it's easier to get out of position, and which feels bad, so then we have to get put back into position again. And it's this vicious cycle that ends up being a really short-term mentality, and it can be a fantastic treatment to do manual therapy to get you back into position to get short-term relief, but it's not something that should be repeated over and over and over and over again, because that really does run the risk of causing a gradually worsening scenario. Instead, what we really should be focusing on is strengthening. Strengthening the muscles, retraining the muscles to fire correctly, because it's important that these muscles still fire the way that they should, but getting these muscles to fire correctly ends up being the number one most important treatment for this type of scenario. Now, oftentimes when these muscles themselves are freaking out and not firing correctly, the muscles themselves become pain generators, and these spasming muscles can get treated in specific manners, such as massage or myofascial release or other manual therapies, as well as some injection treatments like trigger point injections of just injecting into the numbing solution into those muscles, or dry needling of those muscles, or even things like Botox injections into those muscles. Botox being a toxin that actually temporarily paralyzes bands of muscles in which they are injected. These can help relax the muscles. But, if we're relaxing these muscles, but these muscles are tightening because they're making up for loose ligaments, then number one, that runs the risk of causing, the pain relief to be only temporary, but also, perhaps more importantly, runs the risk of actually just causing the feeling of looseness or instability to get worse. If we relax certain muscles, but we don't provide stability to the joint, then other muscles are just going to tighten up, or there's going to be more motion and therefore more irritation to the joints themselves. So these techniques to relax the muscles are only effective short term, and can only be beneficial long term if we pair these type of treatments with the appropriate exercise to strengthen the muscles correctly. Now, finally, oftentimes the appropriate exercise by itself may be sufficient, right? If we get the body moving correctly, we may be solid even if the ligaments still are loose. But if we're strengthening the muscles and the looseness of the ligaments are still causing the muscles to freak out, still causing the joints to get aggravated, right? Then there are treatments that we can try to do to strengthen the ligaments directly themselves. Because strengthening exercises can be beneficial for the muscles, can help strengthen the muscles, but there are no exercises that we can do that can actually strengthen ligaments. So instead, what we use are various injection treatments of orthobiologics. We use things like prolotherapy or sugar water injections, or PRP like platelet-rich plasma, or even in some more severe cases using a patient's own bone marrow. These type of treatments can be used to actually strengthen the ligaments themselves. We've seen cases of ligament injuries or tears actually improve with these various treatments, but we've also seen cases where the ligaments are just loose, get tighter when these injections are used appropriately. That being said, that's still only treating one piece of the puzzle. If we strengthen the ligaments but we don't get the muscles firing correctly, then we're not going to get the most optimal results. So I'm going to go into more detail with the various different types of treatments and options for patients with hypermobility on future Facebook Lives. But the purpose of today was really to kind of outline what hypermobility is, what happens when the ligaments get loose, what are the different possible pain generators when ligaments are loose, and kind of the main things that we can use to help with improving symptoms that are associated with hypermobility. I hope this was helpful for you. If you have any questions, comments, concerns, then please feel free to comment, DM, or you can email us at info@fxregencenter.com. If you want to talk about your specific situation, you could feel free to email us or call us at 310-929-9790. And my awesome patient concierge and patient care coordinator can answer your questions. If you ever want to talk to me about your situation, then you can feel free to contact us and set up an appointment. But realistically, when we have hypermobility, a lot of the things that you need to do are things that you can do for yourself. And getting the right exercise ends up being one of, if not the most important things to help you in your journey to recovery. If there's other topics that you want me to discuss, please also contact us. But I hope you found this helpful. Again, share this, like this. I don't even know all the words anymore. AI this. I don't know. And then tune in next time. We'll be back in a month or so to talk about a different topic. I'll let you all know what we're going to be talking about shortly. If you missed this talk or any of our other talks, they're all available on Facebook, on YouTube, and on our website, fxregencenter.com. I'm Dr. Patel, signing off. Have a great weekend, and see you all soon.